Hi, my name is Dr. Jermaine Bamfo, and I am a trainee psychiatrist currently working in the NHS in London. For Children's Mental Health Week, I wanted to speak briefly about communicating with children during this pandemic and managing their stress. One thing we can say about the experience of living through the coronavirus pandemic is that it is unusual and it can be very stressful. There have been many restrictions and several impactful changes to the way we live and relate to each other. And our children have been subject to many of these changes during this time. And a lot of children may be finding things strange, confusing, and particularly stressful. Children may respond to stress in a variety of ways, such as being more clingy, anxious, angry. They may be noticed to be withdrawing more, or you may notice new behaviors such as bedwetting. There could be a wide spectrum of responses depending on age and developmental stage, but whatever the reaction, it is important to respond to your children in a supportive way with lots of love and attention. So I wanted to give some pointers in terms of communicating with your children during these difficult and unique times. The first is to be open. Invite your child to openly speak about the issue at hand. If they're particularly young, they may not know much, if at all, so find out how much they already know and follow their lead. Be honest and accurate. Correct any misinformation with appropriate facts to reduce fears. Also take your time to explain simple safety measures that your children can take to keep themselves safe and the people around them safe also. Take time to explain the changes that have happened in the world around them and why these have happened. So things such as why we're socially distancing and wearing face masks. Be mindful to keep any explanations age appropriate for all children. Encourage them to verbalize their thoughts and feelings, and also aim to be a good active listener. But most importantly, don't minimize or avoid your child's concerns. Acknowledge their feelings. Reassure them that it's natural to feel worried or scared in this time. Give them your full attention. Make sure you close your conversations about the pandemic with care. The key to communication is not what we say, but rather the attitude behind what we say. So remind your children that you're accessible to address any concerns they have. And then there are some more practical things you could do to help reduce stress and tension. Look to make opportunities for your children to play and also to relax. Look to establish and maintain a regular daily routine, and that provides children with a semblance of control and predictability in a weird and anxiety-inducing time. Also look online for resources which work best for your children to address stress associated with the uncertainties about the future. Monitor their use of television, internet and social media, because exposure to continual updates or excessive exposure to developmentally inappropriate information may increase fear and anxiety. A key thing to note if you're a parent watching this is to take care of yourself too. You'll be better able to support your children if you are coping too. So make sure both you and your children are keeping in touch with friends and family regularly. And also take the time to give yourself space when you need it, time to relax and recuperate, particularly if you're feeling anxious or upset. What would have helped me as a child? Probably keeping occupied, especially if I were not able to go to school. Having my parents check in with me as well to see how I'm feeling. Having them celebrate the positives about the situation, also reassuring me about any negatives which will come my way. There are a variety of resources available beyond the scope of this little segment you're watching today to help support you and your children. The British Psychological Society have a great online 5-page leaflet titled Talking to Children About Illness, which addresses developmentally appropriate responses to children in terms of giving explanation and managing stress. The NSPCC, the World Health Organization, and UNICEF also have very good resources about supporting children during this time. And of course, you can find great supportive resources on the Royal College of Psychiatrists website. Please continue to connect with us on social media to give your own tips and views about communicating and managing children during these difficult times. It's been an absolute pleasure speaking with you today. Please take it easy and stay safe. And remember, there is always support out there to give us all a helping hand. Thank you.